Hey there, and welcome back. Before we get started today, I want to ask you something. Have you ever checked your blood pressure twice in the same day and gotten two completely different numbers? Maybe one reading looked great, and an hour later, the next one looked a little high, and you thought, wait a minute, what is going on with my body? If that has ever happened to you, I want you to know something right away. You are not broken, and your monitor is probably not broken either. Blood pressure is not a fixed number. It moves, it shifts, it rises and falls many times throughout a single day, and understanding why can save you a lot of unnecessary worry. So today, we are going to talk about why blood pressure changes, what is completely normal, what might be worth mentioning to your healthcare professional, and how to get the most accurate readings possible at home. Stick with me, because by the end of this video, you will likely look at your own numbers in a whole new way. Let's start with the basics. Blood pressure is simply a measurement of the force of your blood pushing against the walls of your arteries as your heart pumps. And because your heart is not a machine running at one constant speed all day, your blood pressure naturally rises and falls to match what your body is doing in that moment. Think about it this way. Your body has to respond to everything happening around you and inside you. When you stand up, your body responds. When you eat a meal, your body responds. When you feel stressed, excited, or even a little bit of pain, your body responds. Every single one of those responses can nudge your blood pressure up or down, sometimes by a little, sometimes by more than you might expect. Let's talk about the time of day first, because this is one of the most common patterns people notice. For many people, blood pressure tends to be lower in the very early morning while the body is still in a resting state, and then it often begins rising in the hours before waking, continuing to climb through the morning. This is sometimes called the morning surge, and it is a well-recognized natural pattern in how the body prepares for the day ahead. Blood pressure often peaks sometime in the afternoon, and then, for many people, it gradually declines in the evening, dipping to its lowest levels overnight during deep sleep. This daily rhythm is often referred to as a circadian pattern, and it happens because of natural changes in hormones like cortisol and adrenaline, which rise and fall on their own internal clock. So if you check your blood pressure first thing in the morning and then again in the evening and see a difference, that is not unusual. That may simply be your body's natural rhythm doing exactly what it is designed to do. Now let's talk about stress, because this is a big one. When you feel stressed, whether it is from a difficult phone call, a stressful piece of news, or even sitting in traffic, your body releases stress hormones like adrenaline. These hormones cause your heart to beat a little faster and your blood vessels to narrow slightly, which can temporarily raise your blood pressure. This is often called the fight-or-flight response, and it is your body's ancient survival mechanism kicking in, even when the stress is something as modern as a frustrating email. The good news is that for most people, this kind of stress-related rise is temporary. Once the stressful moment passes and your body calms down, blood pressure often returns toward your normal baseline. However, if stress is a near constant presence in someone's life, that may be worth discussing with a healthcare professional, since chronic stress management is often an important part of overall cardiovascular wellness. Sleep plays a role here too. Poor sleep, whether that means not enough hours or sleep that is frequently interrupted, has been associated with higher blood pressure readings the following day. When the body does not get adequate rest, it can struggle to properly regulate the hormones that help keep blood pressure steady. This is one reason healthcare professionals often ask about sleep quality when discussing blood pressure concerns. If you have ever noticed that your readings tend to run a little higher after a rough night of sleep, you are likely noticing a very real and well-documented connection. Pain is another factor many people do not think about. Whether it is a headache, joint pain, or discomfort from an injury, pain can activate that same stress response we just talked about, temporarily raising blood pressure. So if you check your blood pressure while you are dealing with pain somewhere in your body, keep in mind that the reading may reflect that discomfort, not necessarily your baseline cardiovascular health. Now let's talk about physical activity. Exercise, and even simple movement like walking briskly or climbing a flight of stairs, causes your heart to work harder to deliver oxygen to your muscles. During activity, it is completely normal for blood pressure to rise temporarily. This is actually a healthy and expected response. The important thing to understand is that checking your blood pressure immediately after exercise or after climbing stairs will likely give you a higher reading than your resting blood pressure, simply because your body has not had time to settle back down yet. Many healthcare professionals recommend resting quietly for about 5 minutes before taking a blood pressure reading, precisely because of this effect. Meals can influence your numbers as well. After eating, especially a large meal, blood flow increases to the digestive system to help with digestion, and for some people this can cause a temporary dip in blood pressure. This is sometimes called postprandial hypotension, and it tends to be more noticeable in older adults. On the other hand, meals high in sodium can have the opposite effect for some people, contributing to temporary increases in blood pressure as the body retains more fluid to balance the extra salt. This is part of why healthcare professionals often talk about sodium intake when discussing blood pressure management. Speaking of salt, let's dig a little deeper there. Sodium causes the body to hold onto more water, and that extra fluid volume in the bloodstream can increase pressure against the artery walls. Different people have different sensitivity to sodium. Some people notice a significant change in their blood pressure after a salty meal, while others notice very little difference. This is often referred to as salt sensitivity, and it is one of many reasons why blood pressure management is not one size fits all. Coffee and caffeine deserve a mention too. Caffeine can cause a short-term rise in blood pressure, particularly in people who do not consume it regularly. For habitual coffee drinkers, the body often develops a tolerance over time, and the blood pressure effect tends to be smaller. Still, if you have an important reading coming up, such as before a doctor's appointment, it may be worth knowing that a strong cup of coffee beforehand could nudge your numbers up temporarily. Alcohol is another factor. In the short term, alcohol can actually cause blood vessels to widen, which may lower blood pressure briefly. However, regular or heavier alcohol consumption over time has been associated with higher blood pressure. This is one of many reasons healthcare professionals often ask about alcohol habits when discussing cardiovascular health. Hydration matters as well. When the body is dehydrated, blood volume can decrease, which may lead to lower blood pressure and sometimes symptoms like dizziness. On the other hand, adequate hydration helps support normal blood volume and circulation. This is part of why staying appropriately hydrated is often mentioned as a simple, supportive habit for overall cardiovascular wellness. Temperature plays a role too, in both directions. In hot weather, blood vessels near the skin's surface widen to help release heat from the body, and this can cause blood pressure to drop somewhat, which is part of why some people feel more lightheaded in the summer heat. In cold weather, the opposite tends to happen. Blood vessels narrow to help conserve body heat, which can cause blood pressure to rise. This is one reason some people notice their readings trend a little higher during winter months. Here is one that surprises a lot of people. A full bladder can actually raise your blood pressure reading. Research has shown that needing to use the restroom can cause a modest but measurable increase in blood pressure at the time of measurement. So, if you are due for a home reading, it may be worth using the restroom first for a more accurate result. Talking during a blood pressure measurement is another common but often overlooked factor. Having a conversation, even a casual one, while the cuff is measuring, can raise the reading. This is why healthcare professionals typically ask patients to sit quietly and avoid talking during the measurement. Body position matters too. Crossing your legs while your blood pressure is being measured has been shown in some studies to raise the reading slightly, likely due to changes in blood flow and muscle tension. Sitting with your feet flat on the floor and your back supported is generally considered the proper position for an accurate reading. Cuff size is a detail that is easy to overlook but genuinely important. If a blood pressure cuff is too small for your arm, it can produce a falsely high reading. If it is too large, it can sometimes produce a falsely low reading. Many home blood pressure monitors come with a standard size cuff that may not fit every arm properly, so if your arm is notably larger or smaller than average, it may be worth checking that you have the correctly sized cuff for accurate results. Now let's talk about something many people have heard of but may not fully understand, and that is white coat hypertension. This refers to blood pressure readings that are higher in a medical office setting than they are at home, often because of the nervousness or anxiety some people feel in a clinical environment. It is a recognized phenomenon, and it is one of the reasons healthcare professionals often recommend home monitoring alongside office readings to get a fuller picture of a person's typical blood pressure outside of that potentially stressful setting. This brings us to home monitoring, which can be an incredibly valuable tool when done correctly. If your healthcare professional has recommended home monitoring, a few simple habits can help you get the most accurate readings. Try to measure at similar times each day, such as once in the morning and once in the evening. Sit quietly for about 5 minutes beforehand. Keep your feet flat on the floor, your back supported, and your arm resting at heart level. Avoid caffeine, exercise, and smoking for at least 30 minutes before measuring, and take 2 or 3 readings a minute or so apart, since the first reading is sometimes slightly higher than the ones that follow. Keeping a simple blood pressure log can also be genuinely helpful. Rather than fixating on any single number, tracking your readings over days and weeks allows you and your healthcare professional to look at patterns and trends, which often tells a much more complete story than any one reading ever could. Let's talk in general terms about what blood pressure numbers often represent, while keeping in mind that your own healthcare professional is the right person to interpret your specific results based on your full health picture. Blood pressure is expressed as 2 numbers. The top number, called systolic pressure, reflects the pressure in your arteries when your heart beats. The bottom number, called diastolic pressure, reflects the pressure in your arteries when your heart rests between beats. Generally speaking, a normal reading is often considered to be below 120/80. Readings that are elevated but not yet in the range, typically classified as high blood pressure, may be described as elevated. Consistently higher readings over time are generally what leads to a conversation with a healthcare professional about possible hypertension. On the other end, blood pressure that runs consistently low, sometimes below 90/60, may also be worth mentioning to a healthcare professional, particularly if it comes with symptoms like dizziness, fatigue, or fainting. Here is something important to understand clearly. One single reading rarely tells the whole story. Because so many everyday factors, the ones we just talked about, can influence a reading in the moment, healthcare professionals typically look at patterns over time rather than reacting to any one number in isolation. This is exactly why keeping a log and taking multiple readings across different days can be so much more informative than a single measurement. So, when do repeated high readings deserve medical attention? Generally, if you notice your readings are consistently elevated over several days or weeks, not just once, that is a good time to reach out to your healthcare professional. They can look at the full pattern, consider your individual health history, and determine whether any changes to your care plan may be appropriate. Similarly, if you notice a pattern of unusually low readings, especially alongside symptoms like lightheadedness, blurred vision, or fainting, that pattern is also worth bringing to your healthcare professional's attention. Now, I do want to take a moment to talk about warning signs that are different from the everyday fluctuations we have been discussing. These are signs that call for immediate medical attention, not a wait-and-see approach. Chest pain or pressure, difficulty breathing, sudden confusion or trouble speaking, sudden weakness or numbness on one side of the body, sudden severe headache, or loss of consciousness are all signs that should never be brushed aside. If you or someone near you experiences any of these symptoms, please seek emergency medical care right away. These are not situations for home monitoring or waiting to see how you feel later. They deserve immediate attention. Let's walk through a few illustrative examples to bring some of this together, and I want to be clear that these are fictional scenarios meant to help explain these ideas, not real patients. Imagine someone we will call Margaret, a woman in her late 60s who checks her blood pressure every morning right after waking up, and then again in the evening after dinner. She noticed her evening readings were often 10 to 15 points higher than her morning readings, and this worried her at first. After keeping a log for 2 weeks and discussing it with her healthcare professional, they realized the pattern was consistent with her natural daily rhythm and the fact that her evening readings were often taken shortly after a fairly salty dinner. Understanding this pattern brought her real peace of mind. Now imagine someone we will call Robert, a retired teacher in his early 70s. Robert took his blood pressure at his pharmacy's automated machine after briskly walking through the store, and the reading came back higher than usual. He felt immediate worry, but because he understood that physical activity temporarily raises blood pressure, he waited, sat quietly for a few minutes, and checked again with his own home monitor. His second reading was back within his normal range, which helped him realize the first reading likely reflected his recent activity rather than a sudden health change. And one more example. Let's imagine someone we will call Dorothy, who felt completely fine on a particular day, no symptoms at all, and assumed her blood pressure must be normal. When she happened to check it anyway, her reading was unexpectedly elevated. This is a good moment to bring up a myth worth addressing directly, and Dorothy's story is a great example of it. Let's go through a few common myths because clearing these up can really change how people think about their numbers. The first myth is that blood pressure is always the same. As we have spent this whole video discussing, that is simply not how the body works. Blood pressure is dynamic and responds to countless factors throughout the day. The second myth is that if one reading is high, it must mean an emergency. In most cases, a single elevated reading, especially one taken after activity, stress, or a salty meal, is not an emergency. Patterns over time matter far more than any single number, and true emergencies are typically accompanied by the serious symptoms we discussed earlier, like chest pain or difficulty breathing. The third myth is the idea that if a person feels fine, their blood pressure must be normal. Unfortunately, high blood pressure often produces no symptoms at all, which is part of why it has sometimes been called a silent condition. This is exactly why regular monitoring matters, even when you feel perfectly well. And the fourth myth, which is an important one, is the belief that if today's reading looks good, it is fine to skip or stop taking blood pressure medication. This is something we want to be very clear about. Medication decisions should always be made together with your healthcare professional, and stopping medication on your own, even when a reading looks good, is generally not recommended, since that good reading may actually reflect the medication working as intended. I would love to hear from you in the comments. When do you usually check your blood pressure? Morning, evening, or both? And has your reading ever surprised you the way it did for Margaret, Robert, or Dorothy in our examples today? Sharing your own experience might help someone else watching who is going through something similar. Let's bring this all together. Blood pressure naturally rises and falls throughout the day in response to sleep, stress, movement, meals, temperature, hydration, and even something as simple as a full bladder or crossed legs. Understanding these everyday influences can help take away a lot of unnecessary fear around a single, unexpected reading. At the same time, patterns matter. Consistent elevated readings over time, or consistent low readings with symptoms, are genuinely worth discussing with your healthcare professional, your cardiologist if you have one, or your pharmacist when it comes to your medications. And certain warning signs like chest pain, difficulty breathing, sudden confusion, or loss of consciousness always call for immediate medical attention, no exceptions. If today's video helped bring some clarity to how blood pressure really works, I would really appreciate it if you hit that like button, subscribe if you have not already, and share this with someone else who might find it helpful too. It genuinely helps this channel keep making videos like this one. Before we finish, I would like to be transparent. I am Alan Mercer, an AI-generated educational presenter created to explain evidence-informed health information in a simple and accessible way. This video is for educational purposes only and should never replace advice from your own physician or another qualified healthcare professional. Take care of yourself, stay informed, and I will see you in the next video.